So liposuction has always been one of the most common cosmetic procedures down in the United States. The idea is make small incisions in a person's body in the areas that they're not happy with and pull that fat out. Not everybody's a candidate for it, so when people come in for the liposuction consult, the first thing is, again, we always try to establish the goals and make sure that those goals are realistic. Then what we get into is, are you a good candidate? The ideal candidate for liposuction is somebody who's already in pretty good shape, but they have problem areas they can't get rid of. The other part of it, ideally they're at a younger age, somebody in their 20s or 30s where the skin still has really good elasticity. When somebody is in relatively good shape and they've got great skin, they can get fantastic results because you're treating small areas, whether it's the inner thighs or the love handles or the lower back, and then after the fat comes out, that good skin elasticity allows a really good shrink wrap effect so that the contour looks pretty. The worst case scenario is somebody who's significantly overweight with bad skin. Number one is you're not going to see that dramatic change with the suction. And then even if you see some change, the skin doesn't have the elasticity. So a common thing that we see is some people will come in, they're at a pretty good weight after, let's say, having 3 children. And they have some loose skin and fat in the lower belly, and they say, I just want to do liposuction. Then we go to examine them and we see stretch marks all throughout the abdomen. What those stretch marks tell us is the skin is going to have lost its elasticity because stretch marks are basically damage to the dermis, which is part of your skin. And that's where the elastic reflow comes from. So if that person comes in, we have to say, look, you're not a great candidate for liposuction. What you're a better candidate for is to cut it out because the skin's been damaged. The ideal person stands in front of us. We say, okay, here's a couple problem areas, and your skin looks fantastic. It's got great thickness, no stretch marks, it has a nice quality to it. And so we know when we liposuction that patient, it's going to recoil and have a really beautiful contour. There's alternatives these days to liposuction. People come and say, well, what else can I do? I don't really want to go to the operating room, or I don't want to have a procedure done, or I'm a little bit concerned with discomfort. Other things that we offer, or the main thing we offer as an alternative, is cool sculpting. So for somebody who just says, you know what, I may be a great candidate for surgery, I just don't want to do it. What can I do, during my lunch break? Come in for cool sculpting. Cool sculpting is a great device. Anytime we treat an area, you get about a 20 to 25% improvement. There's no incisions, there's no downtime. You can come in for an hour and go right back to your job. The effects are not as dramatic, but for somebody looking for a conservative change, it's a phenomenal option. There are other modalities, but those are the two we really focus on. So that would be liposuction in the OR, and if it's non-invasive, we really love cool sculpting.